Good afternoon, everyone. My name is Maeve Fogarty, and I'm going to be your host for this afternoon's webinar. I'm the Healthcare Development Manager with Bunzl Cleaning and Safety Supplies, and I look after all the TENA range of products here at Bunzl. Also on the call with me today, I'm delighted we have 3 members of the SD team, and I'd just like to announce and introduce them all. They are Sarah Murray, sorry Sarah, who's our clinical consultant with Essity. Sarah brings 20 years experience with Essity to the call today, so I'm sure you'll get lots out of her presentation. Sarah is the main presenter for today. Then we have Ian Daniels. Ian is the account sales executive who works very closely with us here at Bunzl, ensuring that we can offer an excellent service and support around all the TENA range of products. So thanks very much for joining us. And also, but we don't have Janice on the screen, Janice Matthews, who is the account sales executive. And Janice has been part of our webinar series up to this point. So many of you might be familiar with Janice, and Janice works with Essity up in Northern Ireland and also supports us down here in the south as well. So at this point, I'd just like to offer a very warm welcome to everybody who's come on board this afternoon and taken time out of your busy schedules. I understand that everyone is very busy at the moment, certainly in the healthcare environment. And welcome back to anyone who's been on a previous webinar with us, and a very warm welcome if it's your first time. We're delighted to have you on board. I just want to run through how the webinar is going to run today. The topic, as you're aware, is good continence care equals good skin care. So firstly, what we're going to do is show you a video from Essity that incorporates all their skincare products, which would be appropriate to be used on the skin. And certainly it'll just give you a little bit more background about the aging skin and how the skin changes alter what you would actually use with it. So just give me 1 or 2 moments and we're going to take you over to the video. So I hope you enjoy that, and then I'll hand you over to Sarah for the presentation. Thank you very much.
At TENA, we believe every skin has its own story. Time, frequent washing with soap and water, and incontinence can all affect the skin in different ways. And this is why elderly skin deserves special care. A good hygiene routine is the key to healthy elderly skin, which helps support a resident's well-being. The TENA skincare range is especially formulated for fragile, at-risk skin. In fact, a study showed that changing from soap and water to the TENA range improved skin conditions for 67% of residents. The range is divided into different categories to help you tailor your skincare to individual needs for perineal care and full body hygiene. Cleanse No Rinse products are made using a 3-in-1 formula to cleanse, moisturize, and soothe the skin on a daily basis without the need for soap and water. To supplement No Rinse cleansing, TENA offers Cleanse Rinse Off products for gentle cleansing when a bath or shower is possible and convenient. And finally, the Soothe category is formulated with ingredients to calm chafed or chapped skin. With over 50 years experience, TENA is widely recognized as the global leader in continence care. And this is now being extended to skin care to transform elderly skin health, whatever the need. Because every skin has its own story.
Thank you, Maeve. Thank you very much for inviting me to come and talk this afternoon about our hygiene care solutions that sort of sit alongside our TENA product solutions. What I was planning to go through, was have a look, and just probably for a lot of you a recap, but just to make sure we really understand why aging skin needs that special care and attention. Have a look at some of the different product solutions that we have available in the TENA skincare range and how they work and when it might be appropriate to use them in different settings and with different products, and really understand and kind of focus down on the skin health benefits for older skin of using the TENA skincare range. I understand that the questions can be posed in the chat, so if anybody does have any questions, I'd be really keen to answer them at the end. And if you can pose them as you have been doing or in the chat, that would be wonderful. So, aging skin needs special care. We're all aware of the changes that our skin will go through as we age. A baby's skin and an older person's skin certainly don't look the same, and they don't act in the same way. So as we age, a lot of the functions of the skin will slow down. So our rate of wound healing will slow down. The rate at which the epidermal layer, the very top layer of the skin, will renew itself will slow down. We also find in older skin there's less ability of the skin to produce the sebum, which is the oily substance that's produced to really give the skin its suppleness and keep the integrity strong. We also find as we age that we have less collagen, and so the skin isn't able to stretch as easily, and it thins down. We know that as people get older, the dermis, which is the second layer down, you've got your epidermis as your top layer, and then your dermis can reduce in thickness by as much as 20%. And that can really have an impact when you're looking at any kind of trauma or injuries to the skin, as we lose a lot of the cushioning effect that the skin provides for us. So the protective function declines as well. When we think about using soap and water, it's what most people will commonly wash with. We know that when we use soap and water, the skin has a very fine pH balance, and we have to be careful not to use anything too harsh, as we don't want that upset. Once the pH balance of the skin is altered, then the skin is much more prone to damage. And using soap and water repeatedly, the surfactants that are in the soap can be left behind on the skin surface and cause the skin to tighten, and that can cause irritation. But we'll look at that in a little bit more detail as we go through. The other thing that we have to take into account with aging skin in particular is all the comorbidities or the other challenges perhaps that older people are facing. We know incontinence isn't an inevitability of aging, but we also know that the prevalence of incontinence increases as people age. And so you're likely to be looking at the patients that you're looking after, that incontinence may be a factor and something that they're having to manage and cope with on a daily basis. We also know, unfortunately, a lot of older people will have challenges with their mobility. They may not be completely bedbound, but they might be needing someone to help them move around. And so that in itself just puts the skin under extra pressure, and the skin's then reacting in a different way to what it was when perhaps somebody was in their 30s or 40s. Oops, wrong one. So, thinking and focusing in really on the incontinence related skin damage that we know can occur. Really, when we're looking at damage from the skin due to incontinence, on the whole, we're looking at poor continence management that's going to be the major causative factor. But for some people, particularly if they're very vulnerable, very frail, then just the added burden of having to wear an incontinence pad and the potential of the urine and faeces being in contact with the skin can put an extra burden onto that person's skin and make it more prone to damage. So when we're looking at how we can best manage this for people, it's really making sure that we've got people in the right size, right absorption and the right changing routines for that individual. What we don't want is for the pads to be chafing at the person's skin or irritating the person's skin. And if it's the wrong size of absorption, then there's a potential for leakage, which can make any damage much more likely, any skin damage much more likely. When we know that people are wearing incontinence pads or products, using, particularly if those products that are being used are not breathable. We've mentioned on the slide there, particularly non-breathable bed protection, but what we do sometimes find is that people will quite frequently layer up their incontinence protection, and it's from a fear. They don't want people to find out that they may be incontinent. They don't want leakage to happen, or if they've had a bad experience with using an inappropriate product and it's leaked, then they can become quite fearful of that happening again. And so we can find very often people will end up wearing a pad, potentially with then some washable underwear over the top, or using bed sheets or washable bed squares or something else there, trying to minimise the effects that any leakage might have. And all of those things are just adding to the temperature and the potential humidity and the moisture that the skin's going to come in contact with. So particularly if you're wearing something that's non-breathable, you're going to get moisture trapped in between the skin, and once the skin is exposed to that extra moisture, it's likely to become overhydrated. Very often we use the term macerated, and once the skin is in that state again, it's at a much higher risk of incontinence associated dermatitis, which is the most common type of skin irritation that we will see when we're thinking particularly of patients being incontinent. When we talk about skin being macerated or overhydrated, and very often when we refer to it to maybe potentially family members or somebody who isn't perhaps in the caring profession, we talk about that feeling that you get if you've been in if your hands have been in water for too long, when your skin becomes very crinkled, very wet. You'll notice when your skin's in that state, then the effect of friction is much higher. You can almost rub off layers of your skin. But also for somebody who is perhaps bedbound or in a chair, when the skin is wet, there is a higher level of friction between the skin and whatever the person's supported on. So if they are then moving quickly or sliding down or being pulled up a bed, then there's a much higher risk that there's some skin damage can occur if the skin is wet than if it was drying in its normal condition. We lose the cells a lot more, and we know that wet skin is much more permeable to skin irritants. If you disrupt that almost brick-like structure that the cells have got in the epidermis, if we disrupt that by making it over wet, then the bacteria and other microorganisms that are present on all of our skin and on all our skin and normally cause no problems at all can kind of get in through the gaps and potentially kind of colonize, causing infections for the person. We always say that it's not, as we say that incontinence isn't an inevitability of aging, then incontinence associated dermatitis is not an inevitability of somebody wearing a product or being incontinent. We know figures on how many people actually suffer from IAD are difficult. It's not something that currently is reportable, and the scales of levels of moisture lesions or IAD are not something that's widely used. Every different area will have different ways of reporting it. Unlike pressure ulcers, which we know have to be reported and have to be graded. So knowing how many people actually are suffering from IAD can be difficult, but studies have shown it could be anywhere between 5 to 35% of people in long-term care institutions and hospitals. So we know that it can be very common. And we also know that compared to a pressure ulcer type injury, a moisture lesion or incontinence associated dermatitis, because it's affecting, excuse me, higher levels of the skin, it tends to be much more painful than a deep pressure injury and cause a lot more discomfort. Sorry about that. But we also know that it's preventable, and that if we can make sure that the patients are having access to the right quality products, appropriate toileting routines and good skincare, then it isn't inevitable that somebody is going to develop this IAD. And from TENA as a company, everything that we try to do is to promote good health, and that's the same with skin health. We want to promote the use of the correct skincare products in the right way so that IAD or incontinence related skin problems don't become an issue. So we have the 3 steps that we would talk about to help maintain skin health. Very simple: keep it dry, keep it clean, and keep it protected. When we're talking about keep it dry, we're really talking about making sure that the person is in the most appropriate size, style and absorbency of pad. Whenever anybody's wearing or needing to wear a body worn pad, and it's important to say really that pads or incontinence pads should always be body worn. They are never designed to be laying on beds or for people to be sat on them on chairs. They should always be body worn. You'll have to take a measurement of some sort, whether it be a waist measurement for a fixation pant or a hip measurement for an all-in-one or a pull-up pant as you see there. You need to know the size of the person to make sure you can get the correct size. All of the products, once you get into the range for moderate incontinence, will have wetness indicators, and those indicators are there to help you assess whether somebody is in the right absorbency of product, whether it's too high or too low an absorbency, whether leakage has been an issue or whether it is a fitting or a size issue, and also to help you judge appropriate toileting routines and times of change for that individual. And when it comes to assessing for suitable style, we've got lots of information and guides and tools to help people out to decide what is the correct style. It can be quite confusing really for people to know what style of pad is going to work best for them, and so we have matrices and other things available where you can look at the availability of care, whether the person is mobile, whether they need to be hoisted, along with their gender, and all those other kind of issues that might have an impact on the style of pad that you would use. We've recently upgraded our products with the Pro Skin, so we've got the Field Dry Advanced in there. So our focus when it comes to our absorbent products is making sure that we keep the skin as dry as possible, as quickly as possible, and making our products as breathable as possible so we can reduce that burden of heat and humidity on the skin wherever we can. Keep it clean. We've got a wide range of cleansing products within the Tenor range. You may be familiar with some of them may be new to you. I hope you can see all the different styles from that slide. The ones that we mainly in healthcare would use would be the wash cream and the wash mousse. We have 3 products that we would class as 3-in-1, so they would cleanse, protect and restore, and those would be the wash cream, the wash mousse and the wet wipes. We also have wet wash gloves that you can see there, and dry wash gloves. Those are sometimes more suitable for full body washes, and the soft wipes and the cell duck, which are dry wipes that you can use. We also fairly recently introduced the Shampoo Cap, which is I never know how to describe it because it kind of does what it says on the tin really. It's a shampoo cap, so it's an alternative way of washing somebody's hair when water isn't available. I kind of presumed, I hadn't come across these until I worked for TENA, and I presumed it would just be impregnated with dry shampoo, but it is actually contains within it a shampoo and a conditioner so that the hair does get a really thorough clean and is left damp so that you can style it. So when we think about the no rinse products, which are the Tenor wash cream, wet wipes and wash mousse, how do they actually work? What is the benefit of those products compared to soap and water? All our no rinse products, like Tenor wash cream, they have an oil and water emulsion. So the emulsion within that oil and water application is gently removing any dirt or any residue of urine or faeces off the skin. They don't require rinsing with water. So they are really, when you're thinking about having to go to somebody and cleanse them, particularly in between pad changes or toileting routines, not requiring water means that you're not having to get a bowl, you're not having to get wipes or towel or flannels or any other things that you would use to wash somebody with, take them to the bedside. And as we know, it's not the most dignified of things to have a pad change and to have your perineal and genital area cleaned. It can feel a little bit overwhelming for some people. So to use soap and water and have to wet the skin, soak the skin, rinse the skin, dry the skin, you're adding the extra, I always think the extra time and the extra contact with the patient in something that isn't a particularly pleasant for them to have to undergo. Whereas with the no rinse products, it's a much more simple, less invasive way of cleaning, but effectively cleaning the skin. As I mentioned earlier, when we use soap and water, soap relies on the surfactants that are within it to lift and dissolve the dirt away from the skin. A really important thing if you are using soap and water, and if that is people's preference or if that is all that is available, is that there is a clean water rinse after the soap has been applied. What you want to make sure that you do is you rinse off any residue of the soap or the surfactants off the skin. So you need to, if you are using a bowl or something like that, you will probably have to change the water after you've soaked the skin up to make sure that you completely rinse that water, rinse that skin away with clean water, taking away the surfactants, because it's the surfactants that will stick to the skin and give that tightening and very dry feeling left on the skin. The other thing with the 3-in-1 is that we're talking about restoring and protecting, and our no rinse products are leaving a really thin layer of that emulsion behind, and that's very soothing and comforting to the skin. With soap and water, you're not leaving anything behind, you're not leaving any moisture or anything to protect the skin. If you do leave the surfactants there, they may cause irritation, but in the best case, you're not leaving anything there. With a no rinse product, you are leaving a very slight restoring, moisturising layer on the skin. We know that these no rinse products work. We've done lots of studies over the years. This one was done over a 2-month period in a long-term care facility over in Europe, and they looked at 27 residents using not just the skincare products I've talked about there, the wash cream, but also some of the other hygiene and skincare products we have available. And 67% of those residents experienced improvements in their skin condition. And I think that, you know, this wasn't a unit that had particular issues or particular problems, or that was picked because the skin was in a very poor state. This was just an average long-term care unit with all elderly residents in, and it just shows the improvement by just making a very simple change from using soap and water to the no rinse cleansers. And I think it's the comfort that will bring to those residents, the fact that their skin is less irritated, less sore, there was less scratching, there was less rashes, there was less skin dryness, and all of those things can be uncomfortable and upsetting for residents. So you know, this study, I think, is amazing that there was such an improvement in skin condition. I'm hoping this works now, fingers crossed. I'm hoping that now you can see a paper on the screen as opposed to my PowerPoint presentation. So about well, 20.
Sorry, Sarah, just to say it hasn't come up on this side.
Right, let me have a look. It's probably sorry about this.
Okay.
Has it changed now?
Yes, thank you very much. There it is.
Perfect. So luckily enough, it's my last slide, so I don't have to worry about negotiating my way back to the PowerPoint presentation, thankfully. So this was done at University Hospitals Birmingham. This was done as a reaction to a tissue viability nurse who felt that perhaps, excuse me, the patients within their hospital were experiencing more issues with their skin breakdown and soreness than she really felt she should be seeing, and so they had a mixture of the wards there using the wash cream, the Tenor wash cream, and those wards that weren't using it had issues around the size of the pumps or tubes that were being offered, and so they wanted them to be individualized. So it was an opportunity to look at I'm really sorry about my cough, it's really annoying, I do apologize. To look at whether introducing individual sizes and supporting the trust with education and putting in clear pathways of care would improve the skin condition. And again, I know I don't expect you to be able to read it, I'm just kind of flicking through so you can see it was in the Journal of Wound Care in 2016. But the summary of that is that they found that there was massive improvements in the there we go. So the reduction in the number of incontinence associated moisture lesions on the wards that had the extra support and the kind of really bought into the process, they found that they were reporting 75–76% less moisture lesions during the trial period of using the wash cream than they had been previously. The other thing that this did demonstrate is that the control and the education and the training that Tenor had offered in support of that, to make sure that it was being used appropriately and effectively, and that the moisture lesions were being reported accurately, also helped. And you know, as a company, we're very proud of our education that we offer and the support and the materials. But I think whenever we look at wash cream and trials, the numbers are always quite astounding, really, that 76% found that reduction in moisture lesions. And that's where we would talk about the importance of preventing the skin from deteriorating into any kind of condition where it may need further barrier creams or treatments in place. So I am going to stop, I hope, stop sharing my screen. That was really all I wanted to go through. I hope it's been of some use, and I hope my coughing hasn't been too distracting. I do apologise, it's always the way. But if you do have any questions, I'd be very pleased to answer them. And I'll hand back to Maeve. Thank you.
Hi, Sarah. That was fantastic. Thank you very much for an excellent presentation. I wanted to hand you a glass of water before saying for all the coughing. But no, fantastic overview of how really good continence care and good skin care are inextricably linked. Some fantastic facts and figures there around the no-rinse cleansers. I think they speak for themselves. Just to say at this point, if anybody would like a copy of that study, please just send me an email or give me a call, and I'd be more than happy to send it out to you. It's really well worth a read. So what I'd like to do now is, as Sarah said earlier in her presentation, I would like to invite people to ask questions if you wish. Just to the right hand side of your screen, you'll see a kind of a chat area. I'm going to hand over to Ian, who's going to manage the question and answer session, and then I'll back then later on. Thank you very much. Thanks, Ian.
No worries. Thank you so much, Maeve, and thank you to my SCT colleague Sarah for an excellent presentation. As Maeve mentioned earlier, my name's Ian Daniels. I work for SCT in the Care for Business team, so working very closely with Maeve in relation to distribution of TENA. We've actually had a couple of questions through already, so thank you so much for everyone who's participated in that. And they've asked the question of what's the main difference or any difference between the mousse and cream in relation to TENA. So I'm not sure if that's maybe something Sarah could help us with in this instance. Yeah,
that's a good question. So they both have exactly the same formulation. They both have exactly the same ingredients in them to some degree. They're both oil in water emulsions. It's really the method of application, and in some cases that might be a preference. There is much more variety of sizes in the wash cream, so they start at a tube of about 150 mils and can go right up to large pumps. Some people will prefer the pump application because that gives you a measured dose. We recommend around about a 10p sized amount is sufficient to cleanse after an episode of urinary incontinence, and so having that control is a benefit sometimes in some places. And in addition to that, the wash mousse, sometimes places will have aerosol charges, or the aerosol application might be an issue. There may be infection control concerns that have been raised previously. With both of them, sometimes, and I've certainly seen this in the past, I'm sure a lot of people on the webinar will have seen people use the mousse as they think they can directly spray that onto the person's skin, and there are spray cleansers out there. It's not something as a company we've ever recommended. When you spray something directly onto the skin, you've got the coldness of the aerosol that can potentially upset and irritate the skin and just be uncomfortable for the person. If you imagine you're having something really cold sprayed, it can be a bit upsetting. So either way, whichever you choose, we always recommend that you apply it from a wipe rather than directly onto the person's skin. Does that answer the question?
That's brilliant. Thank you, Sarah. We've just had another question through, so thank you so much for everyone who's participating in questions. We do appreciate it. We've just had a question through that's asking, would we recommend the TENA wash for full body washes, or is it just used for incontinence cleansing? So is it just is it useful for full body or just specific to incontinence? I'm not sure if who'd like to answer that for us, please.
I'm happy to, if you'd like.
Thanks, Sarah.
Yeah. It is recommended for perineal skincare. Both of them are recommended for perineal skincare, but both of them can be used for full body washes. We do have other products within the range, and particularly the wet wash gloves, which are a pack of 8, individual pack of 8, that's sealed so that it can be pre-warmed before use, and that is the number that we would recommend would do a full bed bath and a full wash. But it can be used for a full wash, and certainly I know I've sort of heard people mention that it has been used successfully to what there isn't an issue with it being used all over, but there may be something more suitable within the TENA range.
Brilliant, thank you. That's great, thank you, Sarah. We've also just asked a question, which is quite an interesting one in relation to our products, and asking if they can be used on broken skin. So that's quite an interesting point and a great question, so thank you for that. So again, Sarah, I'm not sure if you'd be so kind to answer that. Thank you.
Yeah. So I think I mentioned a couple of times in the presentation, our products really are there to prevent skin getting to that condition where it may be broken. Once you're seeing skin in that condition that it's breaking down, we always recommend that you would take advice from your tissue viability lead, or you know, whoever you would normally refer to for these matters. It certainly could be. It doesn't. We don't specify in the license whether it can or it can't be. I would say, in my experience, I would check with your tissue viability nurse first. It can be used on irritated skin, but once the skin is broken, it may be that I would check that usage beforehand. But hopefully, if it's used early enough, when people are starting to get maybe the first signs of irritation, it would hopefully, you know, it will prevent the skin becoming broken and sore, just by leaving that little bit of extra protection and moisture there and gently cleansing the skin, as opposed to carrying on with soap and water. Does that answer the question, or have I?
No, I believe so. Thank you. And I mean, as with all the questions, if there's anything, any further queries, you're almost all more than welcome to get in touch. We've just had another one through. Again, a great question. Can the Tenor wash be used for patients with bad psoriasis?
Shall I answer that one?
Yeah, Sarah, if you don't mind, thank you so much.
Yeah, there's like I said, there's no reason why it can't be used on irritated skin. When I was thinking of before with broken skin, I was thinking of sort of a skin maybe that developed a moisture lesion, and I appreciate people with psoriasis can have quite sore, chapped skin. So absolutely, there's no contraindications for using it on people with psoriasis. I certainly anecdotally heard a lot of people who have eczema and other dry skin conditions have found it to be a really useful product that doesn't cause them any irritation, and a really nice way of cleansing their skin because of the extra moisturising factors that it has within it.
Brilliant. And we've just had one, I think probably will be the final question through, and it was in relation to samples. I guess that's one, Maeve, that you can maybe answer, but it's just somebody's asked what's the best way for us to obtain Tenor samples.
Absolutely. Thanks, Ian.
No problem.
Yes, we'd be delighted to organise some samples, whatever you would like for your area, for your you know, your unit. Please just drop me an email. I'm maeve.fogarty@bunzl.ie, or give me a call. Most of you probably will have my email address because it will have been on the invite. So please just drop me an email and I can pick up the phone and talk you through what you'd like to order via samples. We'd be delighted to do that, as well as I said earlier, as well as the clinical papers as well, just to support the presentation that Sarah gave today. So Ian, just to say thank you very much for managing the questions and answers, and thank you, Sarah.
My pleasure.
Your 20 years wealth of experience comes in very handy. Again, thanks to the audience, obviously, for partaking. It's great to get that interaction. It makes for a really interesting and productive session, so thank you very much for that. So overall, I'm really happy that everybody was able to log on today, and thank you very much for taking the time out. We will have another webinar session before the end of the year, and we'll be sending out information about that in due course. But just to say thanks again, really appreciate your time, and we will speak to you soon. Take care.